What is multiple myeloma? Multiple myeloma, also called myeloma, or sometimes MM, is a blood cancer which originates in the blood marrow of patients. Multiple myeloma occurs when plasma cells grow out of control and become cancerous in multiple locations in the body.
So multiple myeloma is a blood cancer. It comes from cells that live in your bone marrow called plasma cells. They're part of your immune system, and when they do their job, they help protect you from infections. They're antibody-producing cells. In myeloma, unfortunately, something changes in those cells, and they begin to grow and live beyond what they normally would. So myeloma is a disease that results from that. And when myeloma is diagnosed, it's usually because those plasma cells or the antibody they produce has started to cause problems, to cause sort of destructive changes or symptoms. So that's multiple myeloma.
When I first really understood what myeloma was, I think it's natural to freak out at first. It's an incurable blood cancer. You hear the word incurable first, and it's very, very scary. Once I digested some of the information I was receiving and understood it's a type of blood cancer that can be managed nowadays, it's a little bit different than 20 years ago when it felt more like a death sentence. It could be managed. I started to feel a little more confident. I think initially I had to understand that I would probably go through this grief cycle and have a little bit of the shock, have some denial, have some anger. And once I accepted that, it became a lot easier. But when I first understood myeloma, it was scary, it was shocking, and it just took some time to finally settle in and understand it better.
A series of tests confirm multiple myeloma, and the International Myeloma Working Group has a set of test criteria to make a formal multiple myeloma diagnosis